My name is Leanne. I'm a primary healthcare coordinator and I work for Nova Scotia Health.
For many of us, most of our contact with the healthcare system will be through appointments with our family doctor. We call it primary care because it's where we go first to access the care we need. That regular contact we have with someone who comes to know us over time is important to helping us stay well. But sometimes it's hard to get into your family practice when you need to, and some people don't have a doctor or nurse practitioner at all. Collaborative family practice teams are an approach where not all of your primary care has to come from your doctor. Instead, your doctor is part of a team that could include a nurse practitioner, family practice nurse, physiotherapist, or a range of other health professionals. In a collaborative family practice team, you can get support from the person with the right skills to meet your needs. Collaborative family practice teams will bring better care for patients, help us attract and keep new family doctors, and improve the whole healthcare system in Nova Scotia. To learn more about collaborative family practice teams, visit www.nshealth.ca.
Primary health care also encompasses chronic disease management, and a lot of our programs and teams that we'll refer to are in Kings County but also provincial. I live in Kings County, I live in Canning, and I work in Berwick, so I regularly get a good view of the valley from home to work. So today I want to talk about just generally what is primary health care, and that refers to your routine health care, your routine health needs, and that could be your annual appointments, it could be chronic disease checkups, it could be that you've developed a new symptom. Primary health care refers to that sort of first visit along your healthcare journey. So when we talk about primary health care providers, often people think about their family doctor or their GP or their nurse practitioner. And there are a number of different models of primary health care. Sometimes it's a solo, one doctor working alone. Sometimes it's a nurse practitioner in a clinic. But we also have what we would call collaborative healthcare teams. And that could be any complement of doctors, nurses, nurse practitioners, family practice nurses, LPNs. It could include a social worker. It could include an occupational therapist, dietitian, kinesiologist. And in a collaborative practice, the patient is at the center and you're referred to the healthcare provider or the healthcare professional that best meets the needs that you have at the time. So for example, if you needed some help to navigate resources or funding for some changes to your home, you might be referred to the occupational therapist. If you needed some navigation around funding for, say, mobility needs, you might be referred to the social worker. If you had a recent diagnosis of, say, diabetes, you might be referred to the dietitian in the practice that could help you figure out a new dietary behaviors. Next time you go to an appointment at your primary healthcare provider or your doctor or nurse practitioner, ask if you're part of a collaborative health team. Another part of primary healthcare is chronic disease management. And Nova Scotia Health has a number of virtual programs available to Nova Scotians with a Nova Scotia Health card. These programs are free. They're delivered by healthcare professionals. And they're on a website called ADRIANNA'S.ca. So if you were able to search that, you'll find a catalog that has many programs that relate to healthy eating, to physical activity, to mental wellness. And you can choose and register for these programs. You'll need to have access to the internet and access to a device that has a camera and a microphone because they are interactive. You have the opportunity to speak to the professionals and with the other participants in the room, which is a great way to learn when you're learning with others who have similar interests to you. So if you go on that website, follow it regularly, check in regularly because there are some new programs added. And also, if you follow any of the social media pages for Nova Scotia Health, so Facebook, Twitter, you'll be able to see when some of these programs are advertised as well. And often, some of the family practice teams in our area also share those on their Facebook pages. So if your practice has a Facebook page, try to follow that for up-to-date information. Personally, I've accessed some of these programs. As I said, there are a number of them, and everybody is on a different sort of stage in their wellness. At the time, I was interested in learning how to get some better sleep. So there's a program on strategies for sleep. I also was interested in changing some of my health behaviors, and I went on a program to learn how to set goals. And there are a few of those. You can participate in those programs. There are taped versions of the program. There are live programs on goal setting. And there's newly added, it's called Health Goal Coaching, where you can book an appointment, a one-on-one appointment with a healthcare professional who can help you to set goals and reach those. And it's all based on what your choices are. They just help you to keep you motivated. So those are a number of programs. There's also a number of resources on that page. So for example, there are some videos that you can watch, exercise videos that you can watch and exercise along with. And there are different stages based on what your needs are. There are a number of recipes that have been chosen by dietitians to help you with, if you've been newly diagnosed with diabetes, there are recipes for that.
Are you looking for trusted information on living well and managing your health? Are you interested in developing knowledge and skills in healthy eating, physical activity, mental wellness, parenting, and reducing your health risks? Nova Scotia Health offers a variety of online wellness programs for adults of all ages. The programs are offered in a friendly group setting using Zoom for Healthcare and are facilitated by healthcare providers and trained volunteers. Programs are free and open for anyone who lives in Nova Scotia. A valid Nova Scotia Health Card number is required to register for most programs. Check out ADRIANNA'S.ca for more information and to register for a program today.